All right.
I don't know.
This is our podcast or Patreon.
Episode 40, so weekly.
Weekly. Okay. Hello, everyone.
Hi.
Welcome to episode 40.
We're already in episode 40.
What? This is crazy.
Yes, ma'am.
I can't believe it.
Yes, ma'am.
40 episodes,
40
guys.
episodes of us. Yes.
I love it.
Yeah.
I'm so happy we're here.
I
Okay.
know.
All right, Jules, what are we talking about today? This is something super trendy in the medical world, super trendy everywhere else.
It's everywhere in the news right now.
Yeah.
For something new, something
I mean,
different.
this
so
is
much
like
to talk
breakthrough in medicine, you know?
Yeah.
Things that are like can really, really, really help a lot of people out there.
100%. So, we're talking about CRISPR.
CRISPR, CRISPR. We will discuss what that means, what it does, what it's being used for. Mm-hmm. So if you guys have heard about CRISPR, continue listening. I was going to say keep watching. Well technically keep watching on YouTube.
Especially if you're a Patreon member, then you see it on the day that it comes out. If you're not a Patreon member, you just listen to us on the weekly. It comes out a week later.
Yes.
But Patreons, you get it right then and there.
And now that we're talking about
awesome.
Patreon. So Patreon, guys, is a subscription, okay, where we release weekly episodes. Yes, weekly. Okay, so 4 episodes in the month. And it's Julie and I on video, a little bit more unhinged because we're behind a paywall, so we can let loose a little bit. Mm-hmm. Okay. And they're completely different episodes. So
it's the same format.
Yeah, same format.
But different topics completely.
Yeah,
so
different topics.
You get 2 episodes of us weekly if you become a Patreon subscriber.
Exactly.
So,
and we're going to be talking.
You help us out. You help us out to continue with this.
Yes,
get better
all
equipment.
Of our Patreon stuff for our equipment.
It goes directly into the podcast. Helping us pay for the subscriptions for everything, editing, for better equipment, podcasting's a thing. Yeah. And it's all in house. We do nothing. We outsource nothing.
Yeah.
Like I do the editing, the artwork, the publishing, the social media. It's just us.
Yeah.
Julie
does it all. But anyways, so check us out on Patreon, guys.
Yeah. And for those of you that are patrons, Patreons, whatever you want to call it yourselves, thank you.
Gracias.
You guys are the best. Anyway. All right. So let's start.
Okay.
What is it? What's CRISPR?
All right. CRISPR. So this stands for clustered regularly interspaced short palindromic repeats.
Mm-hmm.
WTF. Let's just keep it at CRISPR. Yeah. Okay. So what is it? It's a genome editing tool that allows for the removal, modification or editing, okay, or addition of sections of DNA. Okay. So DNA, our genetic makeup.
Yeah.
CRISPR, think of it as a little scissor that comes in and starts chopping little things that may be mutated, may have some errors in it, and goes ahead and edits it and corrects it. So it consists of 2 main components, the Cas9 protein and the guide RNA. The guide RNA is responsible for matching a target gene to the CRISPR-Cas9 molecule. And that target gene must have a specific sequence of DNA followed by a protospacer adjacent motif. Okay,
Pam.
This is a lot. Yeah, this is a lot of science. Okay,
yeah. And we're gonna break it down for you.
We're gonna break it down.
I know it sounds like a lot for those of you that are not in the sciences or whatever. Don't just give
don't
it
get overwhelmed.
Give it a minute. We're just defining exactly what it is for those of you that are kind of in the science field, and it gets very interesting, guys. Yeah. Because think of this like a computer programming software.
Yeah.
That you're literally going into coding.
Yeah.
And changing up software.
Yeah, exactly.
But for people, for humans, for not even only people and humans, for crops.
Yeah.
For, plants, animals, everything.
Everywhere.
And we're going to talk about that, but we're just giving you exactly what it is.
So you take this complex, right? PAM, Cas9, all these things, right? Mm-hmm. And then once the target gene is identified, okay, the target gene, which is what we're trying to edit or change or modify, okay?
Yeah.
Once we get to the target gene, the Cas9 endonuclease, all right, cuts the DNA, and the DNA can be repaired by using non-homologous end joining or homology-directed repair. In short, it basically edits it, okay?
Edits your DNA.
Yeah, edits your DNA.
Okay, so if there was something wrong in your DNA,
Yeah.
it could replace it or remove it.
Yeah, it targets it. It's like, oh, I need to cut and edit that, okay, and then correct it.
And we're going to
okay?
give you examples of exactly what they're using that for now, because this is being used already now.
Yes.
To do exactly that. It's pretty awesome.
So CRISPR-Cas9 has shown promise in treating genetic diseases, preventing the spread of diseases, and offering more effective treatments for various diseases such as cancer and HIV. And we'll go into all of this in the episode, okay? So it's also been used in agriculture for crop improvement and diagnostic tools for disease detection.
Yeah.
The technology has been rapidly advancing and is now widely used in molecular biology laboratories around the world.
Yep.
Okay.
It's amazing.
So Julie's going to talk a little bit about the history on CRISPR.
Yeah. So where did this come from? How did we get here? So the history of CRISPR begins with the discovery of CRISPR/Cas protein system in Escherichia coli. E. coli. in 1987. The system was found to be a part of the immunologic mechanisms of prokaryotic microorganisms, bacteria. In 2012, important studies were published that contributed to the development of the CRISPR-Cas9 genome editing tool, so the scissor. We're going to talk about it as the scissor.
Yeah.
So because it's a lot. Since then, CRISPR technology has rapidly advanced and expanded its applications in various fields. It has been used for gene editing, including correcting genetic errors and inactivating or activating genes. So these are parts of your DNA that they are not working, but it could make it work.
Yeah,
you know?
it's either working or not working.
Or not doing it right.
Or not doing it right, or you want to shut it off. So this can do all of that.
Yeah, it's incredible. So CRISPR has been applied in diagnosing cancer-specific genetic sequence changes and treating diseases like Parkinson's disease, HIV, heart disease, and genetic disorders. In addition, CRISPR has revolutionized cancer research by providing new insights into cancer genetics and therapeutic vulnerabilities. Furthermore, CRISPR technology has been used in agriculture for crop improvement and enhancing plant tolerance to environmental stresses. The future of CRISPR involves further advances in delivery systems and minimizing off-target activities. So we're able to just modify for our benefit how we want our crops to grow and what we want them to do and all that using this
If only we
technology.
had a human version of CRISPR.
What do you mean?
Can I cut and edit things that I don't like out of a human?
We're going to get into that.
You think so?
Yeah.
Like to change like personality types? Can you
Well,
imagine?
okay. Well, you're talking about personality types.
Yeah.
Maybe, I mean, we're talking about like,
I'm going to come at you with a scissor.
oh yeah.
Evie's taking CRISPR to a new level.
Oh yeah. It's like crisp.
Anyways.
But I mean, we're talking about Parkinson's disease. So maybe in the future we could change some aspects. Like recently we talked about narcissism. What if we could cut narcissism out?
Yeah, if it's associated with something genetically.
That'd be super cool.
Yeah.
We could all do without narcissism.
Yeah. All right. So current uses of CRISPR. So these are the most recent things being used by this technology or this gene therapy. So CRISPR technology has a wide range of current uses. It's transformed multiple fields, cancer, immunology, by enabling direct genomic manipulation of immune cells for unbiased functional genetic screens and discovery of novel drug targets. So what that means is that we can use this technology to target medications for someone.
That's crazy.
According to their genetic makeup. Okay, so this is what we call individualized medicine.
Yeah, personalized medication.
Exactly. So CRISPR-Cas system, the scissor, okay, is being used as therapeutics for human diseases, including sickle cell anemia, cancer, and diabetes. Sickle cell is the one that just had the big release.
Because it started in the UK and then it just, which we're going to talk about later on, it just was allowed by the
FDA. Yeah.
FDA release
As a treatment.
Exactly.
Okay.
Here in the States.
So even in ophthalmology. So in ophthalmology research, CRISPR-Cas9 has been used to correct pathogenic mutations in eye stem cells and has shown promising in treating inherited retinal disorders. One of the CRISPR-Cas13 systems has been adapted for various applications, including killing antibiotic-resistant bacteria. Hello. Wow. You know, we are talking about bacteria that says fuck you
to everything.
to all antibiotics, where people have to take really strong antibiotics, and we can use that to make it susceptible again.
I know. It's amazing.
So
And we're going to need it because all of these MRSAs and all that, they're getting worse and worse, more and more resistant.
We're having MDROs, or multi-drug resistant organisms, everywhere.
They're practically impossible, almost, impossible to kill. And they're killing people, you know, so we're going to need something else other than, stronger antibiotics.
Yeah. And I have a ton of patients that are like, oh, I get into the black market. And, I just go to Hialeah. And Hialeah, for those of you that live in Miami, you know Hialeah. How can I describe Hialeah? Jules, how can you describe Hialeah?
A very multifaceted area
of Miami. What is it? La ciudad que
progresses backwards.
Yeah,
maybe. I can't say that it's like a.
I'm not gonna shit on it because I love Hialeah. Okay, I didn't grow up in Hialeah, but anyways. So I have some patients tell me, no, I go to Hialeah or Little Havana.
Yeah.
And I go to one of la farmacias there, one of the little pharmacies, and I tell them, give me 5 packs of amoxicillin and 6 packs of azithromycin.
I don't even want to know how they are able to get these without a script.
No, they do. You just go and order it. I've had people get steroid injections, B12 injections, everything without a prescription. And here we are talking about antibiotic resistance, and it's because of that. And I don't really think people understand antibiotic resistance.
No.
And why should they, right? It's not something that's really talked about in small talk between people. So
no.
But this is what we're talking about. So now CRISPR has given us a chance to genetically edit this, out of these bacteria that are resistant to be sensitive to these and susceptible to these medications to help us, right? It's also used in developing highly specific detection tools, regulating gene expression, and modifying RNA in vivo. So RNA is what we use. So basically we have our DNA, and then RNA, so our cells will copy that, with this little machinery. It's going to copy the DNA into RNA, and then we use RNA to make our proteins to make what we use to function on a daily basis.
So since we've talked briefly about modifying crops and whatnot, I was doing this research and I'm like, okay, we've all heard about GMOs, genetic modified organisms, all of that, about foods that are GMOs and all that stuff. How does that relate to CRISPR? Because they're not the same. Yeah. It's easy to think that they're the same, especially when, you're introduced to it like we just did. So let's go ahead and break that down for you. So CRISPR technology and GMO, genetically modified organism, foods are related in that they both involve the modification of an organism's genetic material. However, the methods and outcomes can differ significantly. So GMO typically refers to organisms that have been genetically modified in ways that do not occur naturally, often through transfer of genes from one species to another to introduce new traits like pest resistance or drought tolerance. Okay, so we're taking from one different species and we're putting it into another species. That's GMO. Now, CRISPR is a more precise genome editing tool that allows scientists to alter an organism's DNA by adding, removing, or altering specific gene sequences. It's often used to create changes within the same species, which can result in crops with improved traits such as higher yields, better nutritional value, or resistance to diseases. But how it mainly differs is that it stays within the same species. Unlike GMO, they get it from different species and practically make a new species, So one key difference is that CRISPR modified crops are sometimes not classified as GMOs because they do not necessarily contain genes from different species, as I have reiterated it. Instead, CRISPR may be used to edit the genes that are already present within the organism to enhance certain characteristics. So in summary, while both CRISPR and GMO technologies aim to improve crop traits for agricultural benefits, CRISPR offers a more targeted approach to genetic modification that may sidestep some of the controversies associated with traditional GMOs. So now you know. Because I wanted to know. I'm like, okay, so what's the exact difference then?
Yeah.
So there you go.
All right. So some examples that have been modified using CRISPR technology includes CRISPR tomatoes. Can you imagine People start like putting this in the supermarket, like
I know.
CRISPR tomatoes, CRISPR mushrooms, CRISPR rice.
It's all there.
I know. So, okay, so CRISPR tomatoes, modified traits for like compact plant growth, larger fruits, higher vitamin C levels, and resistance to disease. The mushrooms, engineered to resist browning. Rice, improving higher yield. Citrus fruits, edited to save oranges from greening disease. Chocolate, okay, altered to save cacao trees. Wheat, modified to remove gluten. Hello, that's huge.
That's what I'm saying. That's why these are examples of how they're being used to modify.
And
you know?
celiac is very,
Yeah, it's hindering.
yeah, it's pretty bad actually.
Yeah. So if you could just like, eat whatever you want because it's CRISPR modified to help you out and digest it, it's freaking great.
Yeah. So these modifications aim to enhance nutritional value, yield, and disease resistance of crops, contributing to more sustainable and efficient agricultural practices.
Yeah.
So think about it, you know, I don't work in agriculture, okay?
Less food waste.
That's what I'm saying. So I don't work in agriculture, but I can only have, the imagination, okay?
Understanding, basic understanding.
The basic understanding. But imagine if we were to use CRISPR to make sure that our food doesn't get any disease.
Yeah.
Okay.
Yeah.
Saves it. Less work, less labor,
Yeah. Amazing.
And
More yield.
Yeah. And then some of these diseases will go and pass on to other types of foods in the same area.
Yeah.
Crazy.
It's good all around. I mean, right, at least for what we're talking about right now.
Yeah.
So the public's thoughts on CRISPR, because there's a lot of thoughts on CRISPR.
Like always.
And
everyone has opinions.
Yeah, and I have my positive thoughts as we've seen, and I do have my hesitancy too, and we're going to talk about that, and we're going to start right here, right now. So the public's perception of CRISPR technology is complex, as mine are. I mean, mine are complex and varies widely. So according to a Pew Research Center survey, while there is considerable interest in the potential health benefits of gene editing, there is also significant level of wariness, particularly among parents of minor children and heavily religious individuals. In general, people tend to support the therapeutic uses of gene editing, such as treating or preventing serious diseases at birth. However, there is less consensus on the use of CRISPR for enhancements, such as increasing intelligence, which is largely used as a misuse of technology. Yeah, you're touching now on ethically, worrisome area. Yeah. So social media analysis also reflects a range of opinions from positive to neutral to negative, with sentiments fluctuating over time. The conversation spiked in 2018 with mostly neutral and negative sentiments, particularly around the topic of hashtag CRISPR babies. So overall, the public takes a cautious stance towards scientific research on gene editing, drawing distinctions based on specific applications and ethical considerations that are involved. So let's talk about the ethics of it, I guess.
Yes, because in medicine, there's always some ethics that's involved.
Yeah.
So what are the ethical concerns regarding CRISPR? Let's talk about the main thing, safety, okay?
Yeah. Start with the basics.
CRISPR, it's actually been shown to be safer than a lot of the other gene therapies that we have.
Yeah.
Okay. So the possibility of off-target effects, unintended changes to DNA, and mosaicism. So basically, when some cells carry some of the DNA, like the original DNA, and then the other ones carry the CRISPR edited DNAs, raises safety concerns. Okay. So informed consent is also another thing. It's challenging to obtain informed consent for germline therapy because the individuals affected by the edits or the future generations cannot give consent. Okay. Justice and equity. There's concern that genome editing may only be accessible to wealthy, leading to increased inequality. That's a hard balance.
It's a hard balance.
That is a very hard balance because I can see some of that fear.
Yeah.
Slippery slope. Some worry that therapeutic uses of genome editing could lead to non-therapeutic and enhancement purposes, which are controversial.
Yeah.
So I can see that too. Like, I don't know what happens. It's all, your DNA is so deep.
Yeah.
And if you start really using CRISPR to like its full potential, could we potentially create, I don't know, like a Hercules or a Wonder Woman?
That's what I'm saying.
I mean?
Yeah.
So, which is insane.
Yeah.
So what about interference with nature? editing the human germline is seen by some as overstepping natural boundaries with unpredictable long-term consequences. So could this mess up our whole entire ecosystem?
Yeah.
Especially with this whole entire like crops and all that stuff. Like we're talking about the life cycle.
Yeah.
So,
Yeah. Complete species changes.
Yeah, exactly.
Yeah.
So survival of the fittest is no longer,
No.
you know?
Yeah.
Okay, so responsibility to future generations. There are questions about our responsibility towards the future generations and the legitimacy of making decisions that affect their genetic makeup without their consent. So these concerns have led to calls for careful consideration, international regulations, and public debate to decide the permissible uses of gene editing technologies.
Yep.
So now Jules is going to talk to us about the hashtag CRISPR babies.
Yeah, that's what started this whole, like we said previously in 2018 when CRISPR was first like really, you know, kind of like thrown out there about all the things that it could do, but mostly about the enhancements it could do. So not like about all just the good things like helping with chronic diseases, removal of like genetic mutations of whatever that are not beneficial. We're talking about enhancements, you know. So CRISPR babies, as they were referred, refers to children born with their genomes edited using the CRISPR-Cas9 technology, so the scissor. The term became widely known after the 2018 announcement by Chinese scientist He Jiankui.
Yep, Jiankui. Okay.
Jiankui? Okay, there, what she said. Who claimed to have created the first babies with edited genomes to confer resistance to HIV, which is great.
Yeah.
This event sparked a global debate about the ethics and safety of germline genome editing, as many changes made would be passed on to future generations. The children, known as Lulu and Nana, are said to be healthy toddlers, but their futures hold many questions due to unprecedented nature of the procedure. So, yeah.
Oh, well, that's
Which is
Lula and Nana. Do
which
they have
is-
an Instagram?
Right?
Can I follow Lula and Nana?
Right? But the thing is, like, if you're, this had said, if you're messing with the germline,
Yeah.
it's not only the toddlers and the future adults that these children are going to be, it's their offspring are now also genetically modified. Not genetically, that's the wrong word. Well, yeah, genetically modified.
Genetically modified, yeah.
Their offspring are also genetically modified. So that whole line
Yeah.
from them on is modified.
Yeah. But could we
So
potentially
it's interesting.
Could we potentially end a lot of diseases?
100%. Exactly. But then that goes back to that other side of the coin.
Yeah.
It's like, how much are we editing? And it's like, it's just a lot. You know, there's a lot to think about in that.
There's definitely pros and cons.
Yeah. I mean, it's mostly ethical, but you know, for HIV resistance, that's pretty cool that
That's
was
just like one thing. You know?
exactly.
We're not talking about editing your genes so you can come out with blue eyes. You know what I mean?
Well, but they can.
Yeah, no, yeah,
And-
I'm
and
saying you
that's-
can, but that's like the whole entire balance.
Exactly.
All right. So, how does the US government regulate gene editing research? Government regulations of gene editing research varies by country, but it generally involves oversight to ensure safety, ethical considerations, and responsible use of technology. In the United States, for instance, we have the National Academic. Okay, we have the National I have like one ear that's like completely clogged.
I know.
Okay.
I'm telling you, it happens with simple words with you.
I know. Okay.
Okay.
In the US, we have the National Academies of Sciences, Engineering, and Medicine. So the NASEM launched an initiative to guide the responsible use of human gene editing research, examining clinical, ethical, legal, and social implications of it. So they recommend strict criteria for clinical trials, especially concerning germline therapy. So germline, okay, in the context of CRISPR, quote unquote germline, refers to the sex cells, so the eggs and sperm, okay, that are used to pass on genes from one generation to the next, okay?
So when we were talking about Lulu and Nana,
Yes,
that's
this
what
is
they
what we're
had.
talking about.
Yeah.
So germline editing with CRISPR-Cas technology involves changes to these cells, which means any alteration would be inherited by future generations. So it's not just Lulu and Nana, it's Lulu and Nana's future kids.
That's what I'm saying. So from them onward, it's edited.
Yeah.
You know, it's no longer like us or like, you know,
Crazy.
Isn't that mind blowing?
Yeah, but then
Yeah.
you talk about genetic mosaicism. So
Yeah.
it's like some cells have CRISPR, but some cells don't.
That's it. Yeah.
So
how does
does that work? You know what I mean?
Mm-hmm.
It's very complex.
Very. Yep.
Okay. So Recombinant DNA Advisory Committee, RAC, okay? It provides recommendations to the National Institute of Health, so the NIH, okay, on research involving recombinant DNA, which includes gene editing. That's another kind of safeguard that we have for the government trying to regulate this. The other regulation is what we all know, the FDA, okay? So it oversees clinical trials and marketing approval for therapies involving gene editing. There's a moratorium on germline's alterations, meaning clinical trials proposals for such alterations are not currently approved. So CRISPR right now for germline is not approved by the FDA.
Like what happened with Lulu and Nana, not approved here in the US.
Not here.
That's why it happened over there in China.
Yes. So the U.S. Department of Agriculture, the USDA, has revised regulations for GMO and gene-edited plants under the Secure Rule, okay, which applies to organisms produced through genetic engineering. So I guess the USDA is basically when we're talking about crops and stuff like that.
Yeah, that would make sense, yeah.
Yes. And then these regulations aim to balance the advancement of scientific research with ethical standards and public safety concerns.
Yep.
Let's talk about Europa.
Europa.
Because, you know, shit's different over there.
That's why I'm like, okay, that's all here, good and dandy in the US. We touched a little bit on China. They allowed it to happen.
The rest of the world? What about Europe?
But then you know how sometimes it happens in Europe and then it trickles over here, like sickle cell, that we're gonna touch upon, and the the CRISPR technology that's now being used to treat sickle cell. It first started in Europe, and then it made its way over here. So we'll talk a little bit about that.
Yeah.
So in Europe, the regulation of gene editing research is guided by a combination of EU-wide directives and individual member state laws. The European Union's approach to gene editing, particularly in agriculture, has been cautious and is subject to strict regulations. And yes, when this first came out in the news and all that, it's very strict. Like they barely have any GMOs out there. Like they practically do. I think in Spain they don't allow GMOs, period.
Okay.
Unlike here, pretty much most of our food is GMO, to be honest. So GMO Directive 2001/18/EC. This directive regulates the deliberate release of genetically modified organisms into the environment and places significant restrictions on gene editing, treating edited organisms as GMOs. The European Court of Justice, the ECJ ruling in 2018, the ECJ ruled that organisms obtained through gene editing are subject to the same regulations as other GMOs, even if they do not contain foreign genes. EU clinical trials regulation. This regulation bans gene therapy clinical trials that result in modifications into the germline. However, it does not specify whether non-clinical research is permitted or banned. The European Parliament's Research Service has also conducted studies to review the governance of genome editing, suggesting that new regulatory frameworks may be needed to address unique benefits, risks, ethical issues, and societal implications of these technologies. Overall, the EU's regulatory stance is one of caution, emphasizing safety and ethical considerations in the advancement of gene editing research. So I think it's safe to say they are a lot more apprehensive to GMOs, CRISPR, and all that than we are. Like we're a little bit more loose on that.
Wild.
Yeah, I mean not as wild as China. Clearly, we don't have
Lulu and Nana.
We don't have Lulus and Nanas here, which would probably be called like Jessica and John.
John and Jane.
John and Jane. Sorry, yeah. Why did I go with Jessica? So yeah.
If you guys don't know what I'm talking about, it's like John Doe, Jane Doe. It's like when you don't know the patient ID, that's what we usually call them. How cute would that be? Jane and John.
Yeah.
All right, anyways. All right, so let's talk about recent news on CRISPR. This is kind of what we're hearing on the media and stuff like that. So things I think that are a little bit more relative to everyone at home.
Yep.
So Casgevy approval. The gene editing therapy Casgevy has been conditionally approved in Europe for patients 12 and older with severe sickle cell disease and transfusion-dependent thalassemia, two serious blood diseases. FDA approval. So on December 8th, 2023, the FDA approved the first CRISPR treatment for sickle cell diagnosis. Approved the first CRISPR treatment for sickle cell disease. The treatment, called Exa-cel, is made by Vertex and CRISPR Therapeutics. It edits the gene involved in red blood cell shape and function and appears to functionally cure the disease for at least 1 year.
It's incredible.
For those of you that don't
Incredible.
know consequences of sickle cell, we're talking about you are more at risk for certain infections. Kids have to take penicillin, okay, as a prophylactic. So every day to make sure that they don't have these certain diseases. We're talking about pain crisis, okay? We're talking about anemia, that they need transfusions. We're talking about acute chest syndrome, which is when they have really, significant respiratory distress symptoms. We're talking about clots, okay? So we are talking about a whole slew of complications that people with sickle cell have that can be potentially cured for 1 year.
Yeah.
And, and we'll see what the future recommendations are. It's like how often they get these therapies and stuff like that. But this is huge.
Yeah.
Yeah.
It's so, it could be really debilitating.
No, it's extremely debilitating.
And even the drugs that sickle cell patients have to take are hard drugs. Like, they are not benign drugs. They have a lot of side effects to them. They're harsh, you know? So if we could do something that could eliminate that, that's amazing.
Yeah. So the first gene-edited meat will come from disease-proof CRISPR pigs by Michael LePage on February 23rd, 2024,
Just
published
yesterday.
on New Scientist. So literally just yesterday.
Yeah, I just added this yesterday.
So the article discusses a significant advancement in the agricultural biotechnology where pigs have been genetically edited to be immune to porcine reproductive and respiratory syndrome, PRRS. It's a disease that costs farmers globally an estimate of $2.7 billion annually. These pigs are expected to be the first genetically modified farm animals to be used for large-scale meat production. The company behind this innovation, Genus, has created hundreds of CRISPR-edited pigs in prep for commercial launch, which could occur within the next 2 years. This development represents a major step forward in the use of gene editing for livestock and could have a profound impact on meat production and disease management in the farms.
It's incredible.
Yeah, so this is just one way that we see this like agriculturally. So we're seeing this medically, we're seeing this agriculturally,
and then agriculturally, and there's a lot of. I mean, that's the most recent with agriculture, but there's a lot. Like, just do a Google search. I'm just putting 2 out there to not make this an extensive episode because it really could be. We just, for our Patreon subscribers, the February recap just came out when you're listening to this on Patreon, and we talked about another recent CRISPR news, another thing that it was approved and is being used for now. So easily, there's so many things. This one just came out yesterday, and I wanted to give you guys 2 examples. One for medical, which is a sickle cell, which is huge right now, and then this one that just came out again yesterday for pork.
No, amazing.
Yeah, it's really incredible, and it's going to save a lot of money to all these big corporations and stuff like that, but it's also going to really help out with all these diseases and stuff like that.
It's going to instill a lot of anxiety in a lot of people, I feel like.
100%.
There's going to be those people on the, at the corner with the signs and stuff.
I mean,
all the time.
That's for everything. But anyway, so thank you for tuning in.
Yeah, guys, thank you.
And we'll see you on the next one. Please keep liking, subscribing, doing all the things.
Yes.
If you want to see more of us or hear more of us, go to Patreon, patreon.com/Funny Medicine Podcast.
Yeah.
We would greatly appreciate it.
Find us on Instagram, Threads. We love Threads.
Everywhere. Twitter. Just find us anywhere. We're everywhere.
Let us know if you guys want to do any specific episodes as well. We have a whole entire list. We are trying to cover as much as possible for all of our requested episodes.
This was a requested episode.
So
And here you have it.
Yeah.
And so we'll see you in the next one.
Bye, everyone.
Bye.